Welcome to the European Wellness Academy. Today we have Miss Stacey Shah, who is with the Energy Source.
Yes.
Yeah, as you can see in her very nice pink uniform. I love the color pink. And she's basically a speech therapist with them, a very senior therapist, I believe, who's been in the business for at least 10 over years. There you go, ladies and gentlemen. So we're doing this project because so April's coming up, right? And so April is Autism Awareness Month, where essentially we want to talk about what it is, so that people get more aware of it, they get more empathy, they start to understand a little bit more about, family members and friends, who may have children who may be in the ASD spectrum, and hopefully, with people becoming more aware, intervention could step in earlier as well, so that the children especially would have a better shot, at basically, how would I put it? What's the right term to use? Normalizing their behavior, or
not necessarily normalizing, but just giving them a better shot of developing and thriving. I would say, thriving in life.
Correct. Okay. So, well, first and foremost, thank you so much for accepting our invitation. All right. Yeah, and so we have some questions actually that was basically directed to us by some parents, who, because of scheduling issues couldn't be with us today. Because if they were, it would be lovely as well, so that, you could have that FaceTime with them. But they definitely have mentioned that, once the schedules are aligned, they might even want to drop by the center and, maybe have a chat with you as well.
Perfect.
Yeah. So what we're going to do is we have 3 questions, okay? And then we're just going to go through one by one. And then basically, you can just sort of off the cuff tell us, what your thoughts are, and that'll be really great. So, essentially, there are a lot of different types of therapies, right, to consider for autistic children.
Yes.
And it ranges from speech therapy to occupational therapy to play therapy, right? So there's that whole range there. So the first question that came in from this parent was, what are the concerns or decisions that therapists would want the parents to know about speech and occupational therapy before even engaging in one?
I think, especially when you're talking about the autistic community, then one of my, not concerns, but one of the things that I really do want parents to know about is the length of the therapy. So depending on how severe the child's autism is, then the therapy can really be ongoing. I've worked with I've been here for about 7-8 years, and there's some children that I'm still working with, I've been working with since the day I came here. And so, like I said, it depends on the the level of autism, it depends on the function, the skills, but it can be very, very long, and it's not a quick fix, and that is my major thing that I try to highlight to parents, because sometimes they think that we'll see the therapist for a couple of months and that'll be my child cured. There is no cure, it's ongoing, and it can take a long time for therapy.
So I think it's fair, Stacey, if you'd say it's more of a work in progress.
Yes.
It's not like I sign up for a package, they come in for like 20 sessions and then they walk out, right, completely fine.
It doesn't happen like that. It tends not to happen like that. Children make remarkable progress, children make slower progress. Every child is different, and so it's really hard for us to determine. Even when we're working with a child, it's still really hard for us to determine how long they're going to need therapy. But I can tell you, generally with the children who are on the spectrum, that it would take longer, and they would need it for longer, regardless of whether that's occupational therapy or speech and language therapy.
Correct. And I would also say that, again, culture would have a certain role to play as well in whether or not parents are comfortable, to reach out to a speech and occupational therapist, because there's always some kind of a stigma, right? I think associated with ASD or any kind of, what we call it, neurodegenerative disorder or even congenital disorders, first and foremost, of course, certain cultures, especially Asian cultures, and I'm saying it from an Asian perspective, being Asian, that, parents would always sort of lapse into this mode of, did we do something wrong? Is it my fault that my child is this way, And so it always starts off, it's a spiral. So it starts off with the shock first, when the diagnosis comes through. And then after that, they start to go down that journey of self-blame and, could I have done something better? Was it something that I ate during pregnancy? And it really doesn't get anywhere, because all it does is it just gives, both the parent this huge amount of guilt and stress, and the child, is also going through stress as well, because when the parents cannot come to terms with it, they would rather not talk about it. So it becomes more of a, let's sweep it under the carpet and let's not talk about it. And so the child doesn't get the intervention that they need. So they end up growing through life, like till even teenage years, not having proper intervention. And that's why they really cannot fit in, right, to society.
And that's kind of the times when you will see some of these challenging behaviours that may or may not be aggressive. And you'll see some signs of anxiety and things, and stress, your child might be autistic, they might be very low functioning, but they can certainly pick up stress from parents. So, and it does have an impact, it really does impact them. And so, it's, I know it's hard because, the culture here, but and there's a lot of stigma attached to, I think, stigma, shame. I don't know, you can tell me more. I feel personally, not necessarily with this speech and language therapy, I feel that people are more accepting of that. I think just it's a bit better known. But then when you start talking about things like occupational therapy, which is unfortunately not as well known, like people don't necessarily know, what it is, then I think that's when you start to see that stigma and that kind of backing off, from the parents, which is very unfortunate.
Yeah. Thank you. So essentially I think that would be some of the concerns, right, that would come out. And I think so that the goal of this session today actually is sort of to tackle, I would say, the taboo with the more sensitive issues surrounding the topic, and that's why we're dialoguing it in its purest, most open form, as opposed to using politically correct terms, because at the end of the day, it is coming to terms with it. It is doing something about it, rather than if I ignore it, it goes away, right? It's not something that goes that way, right? It's not like an annoying salesperson at the door.
Exactly. There is no cure. Currently, there is no cure, and so it's at some point you're going to have to
do it, right? And the duration can be like you mentioned. I think the key message here that we want for the public to take back as well is the consistency, I would say, in the treatment. So you cannot sort of just you come for 1 month and then you disappear for 2 years and then you come back again for 1 month and expect to pick off, right, from where you stopped. If you don't have ongoing therapy, then sometimes the child can regress. So then if you do stop for a while, which unfortunately, because of COVID, did actually happen to a lot of the children that I work with, and that's not their fault, but unfortunately then you do see some of those regressions. You can't just pick up from exactly where you left off, but we can get your child back to where they were. Lovely.
And then proceed from there.
Okay, so sort of they could go back to the previous checkpoint, and then you can sort of start building from there. Okay, lovely. Thank you.